We're entering the second session this afternoon with the title of Fitness for Health. And we've got three speakers who are each looking at sort of different aspects of that. The first speaker, it's a real pleasure to have here Dr. Dimitris Spathis, who's a research scientist at Nokia Bell Labs and a visiting researcher here in the Department for Computer Science and at Cambridge. And he previously received his PhD working with Professor Cecilia Mascolo, and during his studies, he spent time at Microsoft Research, Telefonica Research, and Ocado. His current research interests include data-efficient and robust machine learning for health signals, and he's speaking about human-centric AI for health signals with applications in fitness and activity modeling.
Thank you so much. So, hi everyone. So my talk is going to be a bit more technical than the previous ones, and I want to talk about this exciting area of machine learning and AI, especially right now in the past couple of months, and how we can use these advances for data that come from wearables or smartphones. And some applications I've picked here are fitness, cardiorespiratory fitness in particular, and activity modeling. So let's see, why do we care about this? So I'll first talk about the future. And the way I see it is that if we go back to 2008, for example, when the first iPhone came out, it was a really nicely looking device, but it was an all-purpose device, and it relied a lot on cloud services. So we can even call it a dumb device, even though it was a smartphone, because it relied a lot on the cloud. What we see right now, and the future as well, is that these devices have some enhanced sensor capabilities and on-device AI, so they can run on-device AI models. So we can talk about smart device and cloud here. But I think we're not there yet, so we have many challenges to solve in this area. Most of these challenges that I care about, at least, are data challenges. So the data that these devices collect are very unique, and they're not like applications that we already know. Like we use Google Translate, we use Gmail in our daily life, but all these services use AI. However, in order to use AI in mobile health, we need to solve these challenges. And these challenges come mostly from the way that we collect this data. As the previous speaker said, these data have no labels, nobody has annotated them. They have a lot of noise, they have very irregular sampling, and so on and so forth. So there's some emerging paradigms that we can use, and we can customize, of course, and adapt to these specific data sources. And today, I want to talk about this thing called self-supervision, or finding ways to use this data that are not annotated. And there are many applications that we can apply these ideas to. So some of the areas I've worked on are these ones. They're mostly about mental health and physical health. And we have also done some work on audio diagnostics. But I think there's some people here that will talk about this later. Today, I want to focus on fitness. And I will talk a bit later about why I think this is important. And we might think that fitness is something that only athletes or people who care a lot about sports should care about. But I think on the population scale, it's a very important outcome or even biomarker to track. So I will go back to what I said earlier about machine learning. So if we think of how we use machine learning right now, even with small studies with 20 or 30 participants, we collect the data. We can collect data from sensors, from wearables, and then we take this data and we train small models. However, in other industries, they don't do this thing anymore. They don't start from scratch. They use existing models, existing information that is out there, and they fine-tune these models. So in that way, they use all this kind of knowledge that is hidden in some models, for example, in computer vision or in language processing. Think of the Google Translate that you use every day. But when we talk about sensing data or mobile health data, we don't have these models. So we need, as a community, to start thinking about these ideas. Because if we don't do that, we will start doing the same, we will keep doing the same thing again and again and again, starting from very small data and results that cannot generalize. So a very promising idea, at least in my opinion, is this thing called self-supervision. We use existing data with no annotations, not labels, and we just challenge our machine learning models, the AI models, to predict different aspects of the data. You can predict the future from the past. You can predict the top from the bottom if we're talking about images or video. And by doing that, our models can learn very good, very robust, and meaningful representations. So to apply this to our domain, to wearables and mobile health, we thought of this specific setup here. So imagine that you have an ECG device that is a chest ECG, so it's a bit cumbersome. It's also expensive to buy these devices, and of course, it's very uncomfortable. But we also have smartwatches. So can we essentially use data from one device to predict the other device? And someone would think, okay, that's a bit arbitrary. Why should we do that? If we look into the literature, we know that the way that your heart rate responds to your activity is evident in wearable data. And on top of that, we know that this specific response is a predictor of many different clinical outcomes, for example, cardiovascular diseases or even all-cause mortality. That's a very rough plot from a participant in our studies that we can see that when you get up, first, of course, you move, and then your heart rate peaks, and so on during the day. So we can use this response in order to learn models that can map between the two outcomes. So we designed a machine learning model that does this thing. So we take your activity from your wearables, from your watch, and we try to predict your heart rate. But that's not what we care about. This is just a proxy task. We care about modeling your physiology. And by doing that, we then apply this model to predict different outcomes. One of these outcomes might be energy expenditure, might be your BMI, or different characteristics like your age or even your sex. And we saw that by doing that, the model is actually quite good to picking up these different outcomes. It's worse in some of them, it's better in some other. But what we want to show here is that this proxy task, this mapping between these two different sensors is actually better than working with the movement sensor only, which is what we call autoencoder on the left. And when we plot this result, we see that in the feature space, we can see also differences there. We have plotted, for example, the energy expenditure here on the right. But we saw earlier that one of the outcomes that we can predict with this approach was VO2 max. And let's dig a bit more into that and why we think is important. So VO2 max is the golden standard of fitness, of cardiorespiratory fitness, but it's measured with this kind of devices. It's not even a device, it's a room. So we need a lot of space, these devices are expensive, and most importantly, they're high risk because most people cannot reach their maximum heart rate. So we have to estimate this maximum heart rate. So we had two different questions here. Can we do it with free living data? And if we can do it with free living data, how accurately can we do it? So why do we care about this? So fitness is a very strong predictor of mortality, but until now, we don't have any way to measure it. The only way to measure it is going through this treadmill test. We see here that's a very nice plot that it's even stronger than smoking or diabetes, for example. So we designed this study with the Department of Clinical Medicine here in Cambridge, the Physical Activity Epidemiology, where they have access to this cohort. It's called Finland, and we have 11,000 people, and then after 7 years, some of them, 2,000 of them, they come back to repeat the same test. So we have a baseline visit where they go through the fitness test, and we also measure some other metadata, and then we give them a wearable, and they wear it for 1 week. And then our task is to get this data and train the models in order to predict this VO2 max, this very specific fine-grained outcome. And we can do all sorts of things with that. So first of all, we can test our models how accurately we can predict this VO2 max. And we saw that by adding these completely free-living sensors, so these people were wearing these devices for 1 week. By adding this data, we saw that we improve on the cardiorespiratory fitness outcome, and we have a correlation up to 82%. But most importantly, that's what I care about a bit more. I think it's that we can do all sorts of things here. So this is the original data on the left-hand side, and we can see how the VO2 max is mapped. And every circle here is a participant. So once we train the model on the right-hand side, we see that the model is quite clever, and they can map every user, every participant on a continuum. And on the bottom is users with very low fitness. On the upper part is users with high fitness. And okay, that's a nice plot, but what can we make of it? What can we do is that we can do this thing that I call fitness-aware subtyping or phenotyping. We can start with one user. Let's say that we want to find similar users to this one for a clinical trial, for an intervention, for clustering. We have different applications. And then in the feature space, on the left-hand side, we see the original feature space before training, and on the right-hand side, we see the space after training. So we see that after training, similar users are grouped together. And I also show the query user and the nearest neighbors in the fitness space on the right-hand side. And that's a very straightforward method. So that's how most services that you use operate. For example, Netflix or Spotify, when they want to recommend songs to you or movies, you pick one in the center, and then they try to find in this very high-dimensional model that they have of you, they find similar movies that you might like. So we should use these approaches for public health and digital health. So that's what these models enable. And on top of that, we can also use the data that we have from the retrospective study 7 years later in order to predict if your fitness will change almost a decade later. And we see that we're quite accurate in this one. Of course, the accuracy drops because we're talking about the future. And in the meantime, we see that this outcome, this VO2 max, has become a staple in consumer wearables. So Apple has introduced this feature. Also, Samsung has introduced a similar feature, but they all do it differently. They all require some extra sensors, such as GPS, or they require you to run outdoors at a high intensity for at least 20 minutes, which might not include the entire population, right? Because most people don't work out or don't go out for a run. Fitbit also does something similar. They use static features as far as we know. And on top of that, we see a lot of interest in this area. Companies like Amazon use different data sources like vision to calculate your body fat. So I think in the consumer wearable area, there's a lot of interest in that. But going back to the science of it, we see that there are different ways to use all these signals that wearables generate. And the literature has come up with these 4 families, four approaches. And each one of them has its pros and cons. I would say right now, this thing called contrastive learning that you see here is the most popular approach. Models like ChatGPT, for example, that most people use generative approaches and masking to train. But I think, I'm almost done. But I think what we should understand in this area is what kind of objectives should we use in our models. Should we use generic models that probably can be applied to many different applications or be driven by the physiology and intuition. For example, the step-to-heart approach I showed earlier. I think this is not solved yet, but if I had to choose, probably I would choose a mix of both, and probably I would lean towards the second. So last, I want to thank my collaborators in this project. This is the core team, and there's also Thomas Gonzalez and Yvonne Wu that helped a lot with this project. And thank you very much.